Hey guys, this is Dr. Hub. Today we'll look at the sandfly. So sandfly is also referred to as known as the phlebotomous. So the disease they transmit includes there is Kala Azar. So this is nothing but the visceral. There is the visceral leishmaniasis. Then it also includes there is the oriental sore. There is oriental sore. Then comes the sandfly fever or the Oroyo fever. There is also the Oroyo fever. So they are generally smaller than the mosquitoes and are hairy insects. They are hairy plus it is smaller than mosquitoes. And they dwell in cracks and crevices. So they are present in cracks and crevices. So this is in walls, and this is during daytime. They are active during the night. It is active. This will be during the night, and they are nothing but the nocturnal pest. They are the nocturnal pests. They are unable to fly more than 50 yards. So they can't fly greater than 50 yards. They have to be controlled by insecticides. So you have to control by the insecticides and also by a proper sanitation. So there is also a proper sanitation that has to be done.